because lots of the things that we were raising and escalating nationally, people are now listening and taking some action on. And one of the big critical areas is clearly vaccination. And we're going to talk about vaccination. I'm going to be fairly quick tonight because I'm sure that we're going to spend some time listening to our colleagues from the CCG around the vaccination, particularly the last open access weekend. Another one of the areas was around international travel. And what we have in our population is a population who's really well connected internationally and have been legitimately traveling. And anybody who travels abroad at the moment is traveling legitimately, because if they weren't, they wouldn't be allowed to leave the country. So we've had quite a lot of international travel from Luton, as we would expect for a population with the makeup that we've got in Luton. Some of it long haul, some of it shorter across to Europe, but all of it legitimate. And what we've seen is people, when they come back, are doing what has been asked of them, quarantining and taking tests in really large numbers. So we're incredibly grateful to our population for following the guidance. What's not been very easy for us has been understanding the data around people who are travelling and then quarantining back in Luton. And that's been one of our big asks upwards, is around, can we at a local level have better information? And it's proving to be actually quite challenging. It's not just Luton, lots of other directors of public health, particularly those that have got airports in their patch, are having similar difficulties in just trying to understand. What we would really like to be able to do is to contact everybody who returns back and is being asked to isolate, so that we can offer them local support, because we know from our contact tracing that people much prefer that local contact. And that's one of the things we'd really like to do. We're making some progress on that. We had some really good conversations this week, and I've got a conversation with Public Health England tomorrow who actually have all of that information. I'm hoping that we might be able to do that in Luton. And I think that might actually just really help us, particularly as we move forward and travel is no longer only essential, but more of us can travel, to make sure that we're doing things as carefully as we possibly can and in the right way for Luton. One of the other asks was around testing, and I'm really pleased to say that we were very quickly given permission to be able to, instead of only being able to hand out tests at our test centres, being able to hand them out through lots of different routes. And you may have seen some of our posts this week around being able to now pick up tests from the mall. Lots of places of worship have come forward. And if you're part of a place of worship and you would like to distribute tests, please let us know. We'd really like, and I think I've said this before, we'd really like picking up a test to be as easy as going out and picking up a pint of milk. And Tony's on the call again today, and Tony is leading this for us. We're very keen to encourage our population to get tested, preferably twice a week, but certainly get tested regularly using these rapid tests. And one of the other things that I would also say is about making sure that the people are reporting the test results, because that's how we know how well our population are participating. So it's really important that if you are testing, that you also give out. I've just seen a couple of comments. Tim, absolutely, please get in contact with us. Tony usually puts his email in the chat, and Tony, if you don't mind doing that again, that would be great. And I love Sandia's idea of nurseries, giving them out to families. I think that would be great. We're distributing them through family support workers to families through schools. So extending that to nurseries feels like a natural extension. So that's brilliant, really good. So from being number one in the charts last Monday, we dropped really rapidly. And actually our numbers reduced by 47% within a week. And that was down to the effect of international travel. They've stabilised a bit again, and we think that that might be because of people returning from India before they went into the red zone. And so we would expect the numbers to again begin to decline over the next couple of weeks when that impact is reduced. As soon as I say return of travel from India, I'm sure some people's minds are going to variants of concern that we're hearing about in the press. And certainly we've seen the impact of that on the images that we're getting from India. And my heart goes out to anybody who's got family in India and is feeling the struggle of being so far from them. It must be really, really worrying at the moment for your relatives. We haven't had any variants of concern in Luton, and certainly not any that we've had to follow up on. And this week, we've started to get the wastewater testing results. Now, you may remember that I mentioned that we've started to test in some areas of Luton the water from the sewers. So water that is flushed down your toilets, we can test to see if there's any COVID in there. And the results that we got today didn't find any variants of concern. They're going to repeat that again and to see if they can pick any up. But at the moment, it doesn't look as though coming from our communities, we're picking up any variants of concern, and we're not picking it up through the tests either. And I think that's a very reassuring position for us in Luton. It's certainly, when I heard it this afternoon, I let out a little sigh of relief for that as well. Because we've got so much to get through, I'm going to take a pause there. I'm happy to take any questions before we move on to vaccination, Amanda.
Okay, so I can't see any hands up, Lucy. So would anybody like to ask any questions about Lucy's overview? No, I see Michelle in the chat has said there's been a machine installed next to the entrance to the market where you pay for a bottle of sanitizer or a test, just in case someone should mention it. I don't know whether, Tony, you've got any comment to that, have you? I'm assuming, Michelle, that you're talking about tests.
I haven't seen a machine, Michelle.
I've got a picture on my phone, so I'll have to add it into the chat. It's something I saw today.
Yeah.
Because I'm working in the market, and it's just like a white box. And it's got a sign on it that says that you can pay so much amount for sanitizer and so much amount for a test. Doesn't say what kind of test or anything. It's all contactless, and it literally is like pressing buttons and paying. When we come off the call, I'll have to put the picture into my chat.
I'm watching Tony Green's face, and he's shaking his head in despair. Tests are available in the mall, and they're free. So we'll talk all about that test. Michelle, thank you for bringing that to us.
Yeah, thank you, Michelle.
I did see Tony waving at me a second ago.
Tony, did you want to come in?
I've just done. Yes, in fact, can you hear me?
Yeah.
Yes, sorry. Yes, I wasn't too sure. It went mute and then unmute. Are there any special facilities being installed at Luton Airport? We've seen the facilities at Heathrow, which obviously didn't command a great deal of use, but does Luton Airport have any parallel facilities in terms of testing for travellers?
Yeah, I understand that they've got a number of testing options, and they've just had an additional one start. So they've got quite a lot of testing now at the airport. Luton Airport currently aren't accepting red arrivals, so people coming from red countries. But as we begin to look through lockdown, they're beginning to prepare for that. And people may have seen in the media some private landing of people coming from red countries, and there are arrangements in place for that. And that whole testing arena is part of it. Tony, you have raised something which I've forgotten to say, which is we now do have a red airport in Luton. So one of our red hotel, one of our hotels is now accepting arriving travellers from Heathrow. They are brought in by bus. They don't arrive on public transport or make their own way. And then they are kept in quarantine for the 10 days and have their tests. They do not set foot in Luton. They arrive at the hotel, they stay in the hotel, and then they leave once they are cleared to do so. So the risk for Luton is very, very low. And we are working very closely with the police, with our colleagues in the CCG, and with the authorities around managing that hotel. I actually think it's quite a good thing for us to have, because when the airport does open up and potentially take red arrivals, it means that we've got the systems and processes already in place in Luton. Councillor Roche, I saw your hand.
Yeah, thank you, Lucy. It's really a question around testing, really. Are we happy locally that people are still going out to get tested? So I saw those figures go down a couple of weeks ago, quite low, and they look reasonable to me now, but I just wondered, are you happy that the local people are still going out getting tested? And also, are our businesses and partners, are they going out getting employees getting tested as well? We're still working with these organisations. Thank you.
Yeah, really great participation from many of our workplaces, and really good support across retail. I'm not sure, I'm trying to put this diplomatically, I'm not sure I can be diplomatic. I'm not sure that the national communications advocating twice weekly testing have been as strong as perhaps we would have wanted them to be to get that message across. We've been doing a lot of local communication, but that hands, face, space message that was everywhere and that so many of us can say very, very rapidly, we haven't got quite the same national message about twice weekly testing, although it's one of the most important things that the government are doing in terms of lifting the lockdown. So I think I would want more people to be doing twice weekly testing, which is why we're trying to make the test so easy to pick up. We did have a conversation this week, Cecil and I on the meeting with NHS Test and Trace this week, around trying to make the process of home tests even easier, to make it take less time, to make it less horrible. So are there tests that you don't have to stick it down your throat because the gagging is unpleasant, and tests that are easier to report? So can that, I think they call it a digital journey, can that be made easier to try and encourage people? But we will continue to be advocating twice weekly testing for our population, and we would like more people to be participating in that. So anything that you can do through your networks about encouraging twice weekly testing, and to say that the tests are available free of charge, so that people can pick them up from our test sites, can order them online, and from many of the other places that are now available in Luton. And of course, we've still got the testing bus going round, so that we can encourage participation through that route.
Lovely, thank you very much.
Thank you.
Thank you, Lucy. Shall we move on then? Because I know we've got Martin Logue with us, and we've got Sarah Brown, who are going to talk to us about the vaccine pop-ups from last weekend, I believe. So if I can hand over, I'm not sure who wants to go first, whether it's you, Martin, whether it's Sarah, but over to you.
I don't mind if Sarah goes first.
Where is she? She is here, I saw her. There she is. Hi, Sarah.
Martin, I thought you were, sorry, just to confuse things, thought you were going to do a presentation and then I can just talk about the sort of bits at the end, which I think is, it fits in with the end of the presentation, doesn't it?
That's
that
fine,
would
we
be
can do
great,
that.
Martin. Yeah.
Okay, we'll just try and share my screen with you quickly. Bear with me a second. Okay. Good evening, everybody. And first of all, I'd like to say thank you to everybody who's helped Catherine Haylock and myself in gathering the data from last weekend's mobile vaccine clinics. And those of you who I've spoken to and interviewed, I mean, it's been really, really helpful in helping us write our report and design this presentation. Now, Catherine is on the line as well, and she will present some of the data, and I'll present other parts of the data. So basically, this is a summary or a headline data of the kind of information that Catherine and I gathered over the last weekend in relation to the mobile vaccine clinics in the 3 different locations. So the aims and objectives of the project were to basically measure the number of participants recruited into the vaccination program and their associated demographic data. So for instance, their background, their age, their gender, and stuff like that. We wanted to explore the reasons, including the enablers and barriers for participants going to the vaccination clinics. We wanted to understand the experiences of the staff working on the clinics as well. And we want to try and use the information that we've gathered and to inform and plan, new vaccination clinics in the future. And, hopefully from the information that we gathered, we can actually then maybe design them or kind of shape them into areas where they're more needed or where they're better utilized. So the first slide in terms of the data, I'll let Catherine present. It's on the basically the vaccination data.
Thank you, Martin. Hello, everybody. Good evening. So there were 1,700 vaccinations over the 3 days. These were split between the 3 sites, so almost half took place at Sainsbury's, the Berry Park location, and then almost equally split between the other 2. In terms of the postal sectors where the service users originated from, the majority of these were from the target areas LU1 to LU4, 94% of those. Next slide, if you can, please. Thank you. Looking at the vaccinations by day and time across the 3 sites, 10 o'clock appeared to be the most popular when it just opened, with a steady flow across the rest of the day, with an ever so slight peak again towards the end of the day, possibly due to the time that it was due to finish for the day. Next one, please, Martin. Looking at the vaccinations undertaken by ethnicity, so over a third were the service users were white British, with a proportion of Pakistani, Bangladeshi, Indian, South Asian population, with 11% from white other. This is where the Gypsy Roma travellers would be grouped into. Unfortunately, it's not possible to break down further. Next one, please. Looking at the age and the gender of the service users, the majority of the service users were between the ages of 30 and 49, as you can see very clearly from the graph there. So with many from the age 40 to 49 age group. Over to you, Martin.
Over the weekend as well, there was obviously data collected or information collected from each of the people who had a vaccine as well, and this was done kind of on site. And these are results of the feedback from the service users. So 99% of them are very satisfied with the service or with the clinics, and that's 1,014 over 1,024. 92% would recommend the vaccination process to their friends and family. And in terms of how people found out about the clinics, I suppose the highest number was in terms of word of mouth, which is interesting, and the second was social media. Other includes things like leaflets through work and through things like that. On the right hand side is basically kind of a word. It's called a kind of a word or a kind of a word frequency graph, which tells you the kind of the comments, and they were wholly positive throughout the whole weekend, and there was some really positive feedback and some really interesting stories, and it was really, really nice to see. In terms of what people said, I've got some quotes here as well. So from different people. So for instance, the community worker that I spoke to said anything that reduces or removes barriers has got to be a good thing. And it's a unique start of bringing the vaccination process out to the community and making it more available, so it can only benefit. One of the volunteers I spoke to said he was skeptical at the very beginning, but actually having had both felt that he felt great about it, and he was now here volunteering. Interestingly as well, one of the health professionals described the kind of experience of working in the mobile kind of buses, and although it was quite intimate, there was enough room for social distancing, so it was safe in terms of the working environment. Another person said it was a superb idea to bring it to the community, and it's good for people who don't have the transport to go to the primary care centres and other places that offer the vaccine. And then the service user at the bottom just basically described it. You go in, you get a jab, and you're out. So it was a very, very easy smooth process. So yeah, I mean, we will be doing more work on this. This is just a summary and a headline on what was collected over the weekend in terms of information. Thank you to everybody for bearing with us, and that's the end of the presentation.
Thank you both. That was very interesting. If you could stop sharing your screen, Martin, that would be really great. Fantastic. I know that Lorraine has put a question in the chat. So why were people under 40 to 44 years being vaccinated, and also those under 30 years? Advice is that they take Pfizer. So I'm not sure who would want to. Martin, are you able to answer that question?
I think this is a Sarah one, isn't it?
Yeah.
Okay, Sarah.
Hi everyone, I'm Sarah Brown, Director of Nursing and Quality at HCT, and I lead on the vaccination centres across the two systems.
Sorry, just to stop you, can you just explain HTC first?
Sorry, I work for Hertfordshire Community NHS Trust as the Director of Nursing and Quality, but I'm also the lead for vaccination centres across Hertfordshire and West Essex and Bedfordshire, Luton and Milton Keynes. So I work with both the systems to open up the 17 different vaccination centres that we have, and then obviously working very closely with the different systems to identify different ways of basically looking at how we can really promote the vaccination. Before I answer that question, if I just give a little bit of the feedback to carry on from that presentation, and then I will answer that question. So obviously I was part of the vaccination team over the weekend. It's great to be back vaccinating at different times, and I loved the job. I was on the bus in Berry Park both on that Friday and Saturday. And I think what we have definitely learned from the pilots is that we definitely managed to capture some people that would never have walked into the vaccination centres, would never have booked an appointment at the vaccination centres. So for me, even on day one, we got a couple of those patients through. That made our whole day worthwhile. We had a lady who told everybody that she had autism, was very nervous, very against, had been told by her churchgoers that she was with not to have the vaccination. We spent about 20 minutes chatting with her, encouraging her to have the vaccination. She wanted it, but was just very scared. And then once she'd given me the go-ahead that I could vaccinate, we just carried on chatting to her. And then afterwards she said, well, are you going to give me the vaccination? And we then had to absolutely promote to her that she had had the vaccination and that we had just managed to distract her while we were vaccinating her enough. And then she basically virtually danced around the car park telling everyone that she'd had the vaccination. Now that lady would never have booked through national booking. We also had an 86-year-old gentleman that came with his family with the letter. We had a 70-year-old and a 71-year-old, one male, one female, and only came along because they were being vaccinated with their families and being vaccinated with that support of families. So definitely, you know, for us, it's the right thing to be doing. Obviously, it wouldn't work for the whole population, but we do think that there is a place for bringing the vaccination closer to people and people walking by and asking questions. Obviously, we had a number of people at the weekend that were asking questions around AstraZeneca. Were doubtful, and that's why they hadn't booked. But by being able to talk to us first and having a chat outside the bus and then being reassured, we managed to vaccinate a lot of people. So that was fantastic for us. So the reason why we managed to vaccinate people above the age of 40 is that the region had informed us that national booking was beginning to open that weekend for anybody above the age of 40. Admittedly, it didn't open quite as quickly as we were told it was going to be opened over the weekend, but as people are all aware now, national booking is open for all of 40 to 44-year-olds. People will be getting texts around that. And because it meant that they could go onto national booking and actually book a slot, it felt that it was right that we opened it up, and that was a decision as a team we made on the Sunday to open it up, that we were able to vaccinate, and the comms then went out to say that we could vaccinate those above the age of 40. In regards to the ones below 30, the advice is that the guidance is that we shouldn't be promoting the use of AstraZeneca as a first line choice of vaccine. It isn't saying that we can't give AstraZeneca to those under the age of 30, but we have to have that risk conversation with them. Having said that, we were quite shocked in the data, because everybody that was coming onto the bus, we were asking, are they over the age of 30? And everybody outside the bus was having that, and the posters were as well. So we're doing a further deep dive into those 5 cases that were under the age of 30 to find out, and we will be contacting each of them as well, just to make sure that everything is okay with them. But it is a risk assessment that is presently undertaken with people. If they can't access another vaccine, they can still have AstraZeneca once they've had that risk assessment with a healthcare professional.
Not sure, Sarah, whether you can see the chat, but there's a couple of questions in there to say that you just said over 40, but the NHS website is still saying 42. So, and we've got a couple of individuals who've put that question in there. So I wonder if you could just comment on that.
Yeah, so my understanding is texts will be going out tomorrow to people over the age of 40, because we have been instructed this afternoon to open up our bookings as much as possible, because people over the age of 40 will receive those texts tomorrow. I honestly can't tell you whether or not you could book at this present time on national booking if you were 40 or 41, because unfortunately I have to go in and pretend to be someone, and obviously I can't do that myself. But the guidance that we've had from our regional calls this afternoon is that texts will be going out. So my understanding is national booking is open for 40 and over.
Thank you, Sarah. And Nikki, both Nikki and Michelle have put an answer in the chat as well. So based on what we've just heard then, does anybody have any questions? Would anybody like to ask a question of Martin, Catherine or Sarah?
Sorry.
Lorraine.
Lorraine, you just muted yourself.
Sorry, can I just also just say, in regards to those that were over 40, how did we also vaccinate them? I also forgot that our criteria over the weekend was that we were able to vaccinate anyone over the age of 30 if they attended with family members, or if they had family members that were in any of the other cohorts. So that's why as well, I'm remembering all the cohorts now. It's been 5 days since we did the programme, so unfortunately the whole programme moves on, but actually we were able to vaccinate anybody over the age of 30 as part of this pilot if they lived with somebody in their family. And again, we updated, we made sure that that was very clear to people in the other cohorts. So that's why you'll see that there was a large age range there.
Thanks, Sarah. Thank you. Lorraine.
Right. Comms seems to be a big issue, because even though they were allowed, they should have been vaccinated. Surely the advice was anybody under the age of 30 or 30 should have actually used Pfizer. So hopefully they're aware, and there are specific reasons for that, as we all know. So that's another thing. But the booking line still shows 42, and that was as it was, well, last weekend it was 44. So I'm just going on to make sure that we have a consistent message, even if it has only been signed off tomorrow. The message should have been at the weekend, because I still know of people 18 years that still had that got vaccinated. So there was mixed messages going on in terms of who can get vaccinated, not as much as it was last time, but that is a concern. The bottom line is everybody's got to get vaccinated at some point anyway, so it's no big deal. But I'm just just putting out there about having consistent and
I think we've heard that message, Lorraine. I think Sarah's response that the very small number of under 30s who were vaccinated were done so under a clinical assessment where it was deemed to be clinically appropriate to do so. And your point about the age is we're in such a fast moving position that you're absolutely right. We getting those comms across as quickly as we can for people to take it up is really important. And we're moving down the age bracket much faster than we'd anticipated, which is good news, but does mean that there's a constant, the moving down in 1 year age brackets that we've seen over this last week has I think made things more complicated than if we'd just done the leap down to 40 over. Clear. Can I pick up, Lorraine, in your comments, and the thing you also mentioned around the number of Black African, Black Caribbean community. We remain committed to encouraging all of our population to be able to access. If we were to do this again, what we would really like to work with is much more closely with some of our community around how we can make sure, particularly the Black African, Black Caribbean community, because you can see from the pictures, we're still not quite getting it right with that group. So I think we'd really welcome hearing for groups that people here think are underrepresented, and the involvement of Nolet and the Gypsy Roma Traveller absolutely came from a previous one of these. We'd really be very keen to understand thoughts people have. We did see a real bump in numbers of people attending once the mayor had gone and visited the churches on the Sunday, and we saw a real increase in participation following that. Is it through those church groups that is a really good route for that, do people feel?
Not just the church groups. So there was a number of issues. I was when we were called last Wednesday about this meeting, there wasn't enough pre-effort to done in terms of actually advising the community about this, because it's not only about access, all right, even though there are issues. I think there should be more sites across the town, not just in the areas that we had, but it's about trust. It's about meeting the community and debunking a lot of the myths. There's a lot of stuff circulating, and it's building up that trust. It's a far deeper issue than just looking at access to a vaccine. Going around the churches, I don't think that was done in a very, very, how should I put it, efficient method, because it was didn't encompass all the churches. There's a few churches on Sunday, that's fine, but we've got Saturday worshippers as well. And I was able to get in contact with, for example, the Seventh-day Adventist lead, who I've communicated with Adam and Amanda and Sandra, and also the Luton Council of Churches, the Luton Faith. There's a conglomerate of organisations which represent all the churches. That would be a good, first hit, because they would then be able to communicate. And they're also looking at social areas. It's about cross-cultural communications, barbers, hairdressers, shops, business owners, media, social media, the radio, and it has to, and it's got to be a real comms event, as a real proper work stream to let everybody know that this is in your best interest. This is what you've got to do. I mean, this is what in order for you to be able to be out there, travel, do what you need to do, this is the way forward. And I think that's what's got to be happened. I think going around a few churches on a Sunday, that's fine, but not everybody goes to church now. You've also got the people that are on Zoom as well, because a lot of services are held virtually now. And also, as I say, we've got Saturday worshippers, we've got all the different denominations and faiths. So Luton Council of Churches, good start. United is another one. Yeah.
Incredibly helpful. I've written everything down that you've just said. Amanda, is that a good time for you to talk about the next week event?
It would be. Let me see if I can share my screen, because I'd like to just show, because I know certainly some of you will have seen this in on the WhatsApp group. So what I'm showing you now is what I will send round in an email once we've had the meeting. So we've managed to get together a group of individuals to come together to have a Q&A session as a webinar on Wednesday, the 5th of May. So that's next Wednesday, 6:30 till 7:30. We've got some great speakers lined up. And if you could share amongst all of your networks, that would be really great, because we'd really like as many people to come and join us for this event as possible. So yeah, I mean, this has taken some getting together to get the speakers, but yeah, I think we've got a really, really good range of speakers. So please share once I've sent this round to you all.
It's such an amazing range of speakers. To get national speakers of that quality, Amanda, is just fantastic. And I can't wait to hear Bola speak, because she's just fantastic. So really great. We've got Nikki with us, who joined us at the special meeting last week. Nikki, would you be able to talk to us about what the future plan for vaccine rollout is? So as of tomorrow, we're down to 40. We're still hearing some stuff about lumpy supply, which appears to be Matt Hancock's favourite description. And do we have any thoughts around open access and whether we'll be moving away from a point, anything else you can tell us about what might be coming around the corner for vaccination?
Yes, hello everybody. I think I want just to reiterate what Lucy said about a fast moving pace. It is really fast moving. So as an example, and I know Michelle's put it in the chat, is that as you're aware, the mass vaccination sites and the community pharmacists use the national booking service, whereas the GP practices use their own. It's not the same booking service. Now, as it happens, in the Luton system, it's only Leavale practice are the only practice that are continuing to do what we call beyond cohort 9. So everybody who is 49 and below, all of the GP practices are not doing that, and now in the PCN centres. And that's one of the reasons why we've got Boots in Arndale, and we've got another pharmacist commencing on the 26th. In fact, they would have started. It just shows how fast paced this is moving, which is Dunstable Road. I'll get the name for that in a moment. In fact, I can get the name for you now. That's Acorn Pharmacy, Dunstable Road. So that opened on the 26th, so that's not too far. And of course, what we call the mass vaccination, which Sarah we've got on the line. So she is the expert and can tell you anything on that. So as far as, Sarah, who you've heard a few moments ago, and myself meet with the regional team twice a week. So the supply and fairness is, and it has been a challenge, because we haven't known when it's coming, and that has been a challenge to everybody. And I know there was some confusion at the last meeting why Inspire, one of the mass sites, wasn't open, and that was purely down to there wasn't supply, so there wasn't a service to be given. So moving on, and very helpfully somebody in the chat has put in the fact that we need a different vaccine supply to the under 30. Today we have been told, so this is absolutely hot off the press and you will be some of the first to know, that we have got those Moderna, and Sarah, if you're there, you can chirp in as well. It's the 17th, which is the 10th and the 17th. Yes, the 10th and the 17th, we have got vaccines coming, but it's a moving feast. And that's why every week we give you the timetable where you can see which sites are offering first vaccines and second doses, because now that's becoming a bit of a confusion to people. So our GP practices are only mainly doing second doses. And why it's important, just to explain to everybody, the reason that the practices aren't doing the first doses is that in 11 weeks' time, they wouldn't be available to do the second doses. And as you'll all appreciate, we have to work together. There's a lot of other immunisations, children immunisations, screening, breast screening, cervical screening, long-term conditions. So you can imagine the work that general practice are doing. So in answer to your question, we've got community pharmacists. Now, the reason I was a little bit late on the call is because at a national level, we're also looking at pharmacists, smaller pharmacists being able to do, and we're looking at doses of 90 vaccines a week. So it's really fast moving. And the reason it's fast moving is to make it as convenient to our local populations. So community pharmacists, smaller ones, which we haven't traditionally done. That's likely to come on, Lucy. And then in addition, and Sarah may want to do a bit of a double act, we're recognising that the bus, you can get a bus to the communities that aren't coming forward. And I think Sarah gave some quite eloquent, examples of when people see a bus, it may be that a family member can be encouraged to go to the bus with a family member. So we are really, and in fairness, what Martin presented, some of the learning from the weekend, we've got some really, really rich stories of how do we make our vaccine services accessible to everybody. And that's why the beauty of this call, and the conversations I've heard already, we need to work together. So vaccine supply should be coming, Sarah, I think the region have really said that we're talking about the middle of May is when the supply becomes more plentiful again. So it is a little bit, it is tight for the next couple of weeks. I think it's probably as if we take questions.
I think it's fair to say that what we've been told very clearly, that there's enough vaccine across the country to do all of the 40 plus age, which is why they've opened up that cohort. And like I said, we're monitoring our bookings to make sure that we are opening up more slots if we're getting up to 100% booked, and we'll be continuing to monitor that over the next few days. And then, as Nikki says, then that what they're looking at is obviously Pfizer again being available, and Moderna being available across the different areas, so that we can allow choice again for people to come forward, and beginning to plan for that under 30s, where the first line of choice will be either Pfizer or Moderna, hopefully. But that's today. That could well change in the next couple of weeks. It really does just move that quickly. So that's why we try not to give out too much information until we know exactly what we're doing. But we are now going through the assurance process around doing Pfizer as well in some of our vaccination centres, so that we can offer that range of services. The other discussion that we have been having with Region Learning from the buses is whether or not we could look at walk-in opportunities. It's obviously how you manage that though, and how you staff it when you've already got a lot of people already booked in, but it's something that we are keen to be able to offer, because we've seen that obviously walk-in opportunities do work well. So it's something that we're keen, and Region are very supportive to support us to take that back to national, but it will probably be allocated times we'd have to do that for around when we've already got lots of other bookings.
Thank you, Sarah. Thank you. Scott, you've got your hand up.
Hi, yeah. So from the Luton Community Action Group Facebook page, we're hearing from residents there's a real concern still about, one, getting access to booking appointments. People are still being sent to Carlisle, Liverpool, still being told to go to London for the vaccine. They can't get them locally. People are really, really struggling, particularly with Inspire being closed. I know it opens again on the 8th, but people are really struggling to get those localized vaccines, what I think are turning people off as well. And people are also reporting to us that they're struggling with getting second doses, and people are now coming to week 11, week 12 and not hearing. They're ringing 119 and being told there is no vaccine, you need to wait. They're ringing then their GP, they're saying you need to speak to 119. We've had people who have reported to us as well that they've then rang the CCG and been told you need to speak to 119 or your GP. And actually people are going round in circles. And if we get to past that week 12, we're going to have to start that process again and start at week 1 and have their first vaccine again, because it isn't being clinically proven to go past that. So what assurances can the CCG give to the residents, what I can report back to them on our group, that actually there is those 12-week appointments, no one's going to miss them, because we are getting reports that people are, and I know Health Watch are as well. I don't think Lucy is on this call tonight, but
No,
we're getting those reports. We know Health Watch are as well, because we're reporting them through to Health Watch, and also that there will be vaccine opportunities open, because people don't want to be sent to Carlisle.
Of course. So shall we just slightly unpack that a little bit, because between Sarah and I, we'll try and really give you some answers that really get to the root of the issues. So because Sarah's working with the mass vaccination sites whereby you get the appointments from the 1-1. Sarah, do you want to talk about that first, and then I'll pick up the GP elements if people have had, if they've had I'll pick up the bit of second doses from GPs. Do you want to go first?
Yeah, okay, so it is quite, I completely understand it is quite complicated for people out there. So anybody that's booked via national booking, when they book their first appointment, they should automatically book their second appointment. And that's what national booking does with them, is that they book 2 appointments at the same time. So people that have come to a vaccination centre and had AstraZeneca, they will already have a second appointment. And so our vaccination centres have to sort of work around what's first and second. I can confirm both last night and this morning, we have opened up more slots in all of our vaccination centres. And unfortunately, it has been whilst waiting to look and understand what the vaccine supply is before we can open up those slots. So that's why there is that slight delay. The 119 is to do with national booking. So that's where it is that confusion, because 119 is the telephone service for national booking. So that's only for people up until very recently that have had AstraZeneca. And as people know, you know, the advice is that people should have the same vaccine the second time round. There is guidance that we can give an alternative vaccine if it's in the person's best interest for after a risk assessment, and if it's unclear what their first vaccine was. And the other guidance is that obviously people should be having the second vaccine as close to 11 and 12 weeks as possible. If it is delayed further, then we are just to give a second dose. You don't then start again for a third dose, and instead we're beginning to plan for boosters later on in the year. But alongside that, there is monitoring going on as well of second doses. So the CCG are reviewing with the PCNs to look at exactly who's had first doses, and if they haven't had a second dose at that 11 week, you know, where are we, so that we can start making those contacts. And reminder letters for anyone that's been through vaccination centres, for anyone that hasn't attended for second doses, reminder letters are going out to remind them to come back because they haven't attended for their second dose.
Can you share a link to that, to a government NHS website around that? If it goes over at 12 weeks, they can have it basically past that time as soon as possible, because I can't find it anywhere to share with the residents, and I think that would alleviate some of the worries if actually we can point them to government or NHS website what states that, because I can't find it online.
Yeah, I'll share it with Michelle. We can find that. I mean, I think it's it might be under the professionals' advice guidance, I would guess, rather than it perhaps being absolutely open knowledge, but that's the advice we're given.
Okay, thank you.
I can just interject there. It's on the JCIV or the JCVI guidance, but I can certainly put the link through. I think it's something like page 10, Scott, at the bottom, but they don't need to have a second dose, but I will include it.
Thanks, Michelle, and then I can forward on. That would be great. Thank you. Lorraine,
sorry, Scott, shall I just finish the second question that Scott had?
Yes, of course, yeah.
Yeah, so sorry. So if a member of the public has had their vaccination at the GP surgery, similarly to what Sarah has said, until they know the vaccine is actually going to be delivered and made available, they can't make the appointment. And that is one of the reasons why often people have had phone calls and the appointment is within the next week, because it has got better. In fact, from the 26th of April is the first time that the GP practices have had 2 dates in the week where they've confirmed their delivery date, i.e. if it's some practices have it on a Monday, some have it on a Thursday, but they have the same 2 dates. So that has helped the GP practices. But if anybody is nearing the 12 weeks, we have got a fail-safe number, and I shall again give that with Michelle so we can pick that up. So I guarantee, so Scott, you can categorically give people the assurance there is the supply for second doses. We have absolutely got those for people, and I think part of it is reassuring colleagues and friends.
Thanks, Nikki. Thank you. Lorraine, you have your hand up.
Yes, please. Hi, and apologies again. Bad hair day. Sorry, I'll be going there.
Now we all want to see you, Lorraine.
Okay. I had this instance, but I did put in the chat. We were told that you didn't need any identification in order to do the walk-in, no NHS number. And I had a friend's cousin who rang me and says, we've been to 2 sites and been refused because we haven't got an NHS number. And there's a particular reason why she didn't, because she wouldn't normally be here. She's not a UK citizen. Due to the pandemic, her flights have been cancelled 7 times going back to her country of birth. So the UK government had extended her visa for some months now. So what is that? I mean, how is that? She was turned away. Can we, is that supposed to have happened or not, or what? Can someone ask?
I'm happy to answer that. So people don't need an NHS, they didn't need an NHS number to turn up for any of the buses. We can record on our system for people that aren't registered with the GP, don't have an NHS number, or don't even have an address. That's been a recent update to the patient system that we have to use. Over the weekend, we know that we did actually complete still 8 paper records for people that we were still struggling somehow to get onto the Pinnacle system, that we've then gone away with our IT team to get sorted. So I'm surprised by that, and all I can say is I'm sorry if that person was turned away. What we were also doing on the site, though, for anybody that otherwise would have an NHS number but didn't know it, we'd got the QR codes and we were supporting people, but a lot of people otherwise we were just finding them on the system. But like I said, there was otherwise a paper copy.
Right. Right, what I will do is then I will accompany her. I'll take time and accompany her next time we have a walk-in, and see where we can go from, and then advocate for her if she needs to. If I know that it is as you've stated, I will make sure I'll meet her and advocate for her and take her as well. I don't know her, but do what we got to do.
That'd be great.
Yeah.
Okay.
Oh, and there's another thing. A pastor who was involved in the original, when we had original trial where we're getting community leaders to get their vaccine done, well, he was called by his GP for a second vaccine, but had his vaccine booked on the national booking system. He was still being called by the national booking system, even though he'd had his vaccine. When he went on to try and cancel his booking, because he was concerned that he was taking up a space that somebody else was taking, and I assured him that was not the case. He was told, you've got your vaccine, so it doesn't matter. But he wasn't able to cancel. He was still getting texts saying you've got to attend. Is that anomaly being sorted? This is what he told me.
Unfortunately, I don't think that anomaly has completely been sorted, because there's so many different ways of being able to book at the moment. So national booking will continue to contact people and remind people that they've got an appointment if they're still booked at national booking, unless they've phoned 119 to cancel it. Right. And it just takes a bit of time for the systems to update. It's different wonderful IT systems that we have to use called Pinnacle, and there's another one that other areas are using, and then it all goes into a system called Foundry. So everything has to then marry up before it's finally registered, which is why anybody who was vaccinated on the bus with us over the weekend, we suggested they waited 2 or 3 days before they then contacted 119 or went online to then book a second appointment.
Thank you, Sarah.
Thank you very much. Thank you.
Thank you. So thank you all for that. I think that was very useful, very interesting conversation. And I guess from my perspective, I just would like to say that, that there are several things that are really important for you to share. One will be the Q&A panel for next week, because obviously we want to get those speakers heard out amongst our community, where we know that some may be hesitant. So that's really important. The other thing is around the twice weekly testing, and equally important is if you do your home test kits, to report whether you have a negative or a positive response to that test. So equally important to get those registered. And obviously, as we've already said, around the vaccine. Perhaps, Tim, I know you're on the call, and you've been involved in some of the comms, which has been a BLMK-wide project around looking at how going forward we need to shape comms in terms of people actually listening to our messages around Hammerspace Space and how we look to come out of the pandemic. So Tim, I won't put you on the spot now, but I know you've been involved with that, as has another person from Luton, so Antonio, which from Joan Bailey. Thank you very much, Joan, for putting Antonio forward. So I think we'll do a little update in the meeting that follows this one on the 13th of May. And yes, I'll ask you to speak then. The other thing that I would really, really appreciate, and I know I've asked several times, we've got the survey for you to fill in, and there's been 6 people so far. So I've extended the time frame for another week. I will, in the email that I send out after this, I'll put that link in again. And can I please ask if you could fill that in? It's really important that we know if we've got it right. So what are the comms okay? Do you want to see more? Do you want to see less? So if you could complete that, that will help us going forward. So thank you. And if there are no more questions, we've got 2 more minutes. Lucy, is there anybody else, or sorry, anything else that you would like to add before I bring this to a close?
No, I think, thank you so much. I mean, in Martin's presentation, he talked about word of mouth being the largest driver of people participating. And we absolutely know that it's the mouths on this call that have really contributed to that your support, your sharing with your networks, your challenges to us, for us to do it right and to do it better, has made it as good as it was. And we so appreciate all the time that you give, the support you give, the energy that you bring to this. And we are moving into a much better position. So we're hoping that as we move forward towards lockdown, we can be giving messages about living with COVID and what the longer term will look like, rather than having to be talking about our response all the time, which I hope will be a really positive place for us all to be in. Thank you all so much, as always.
Thank you, Lucy. And thank you very much to our speakers as well. So thank you to Nikki, to Michelle, to Martin, to Catherine, and to Sarah. Thank you so much. That was really useful. So thank you for giving up your time and coming along. So Lorraine, if it's very quick,
it will be. It's actually a comment I put in the chat. There's
that's a yes, Lorraine.
Good.
We are advising across all aspects of that election.
All right, that's good. Good. They're going to be. You're going to be present at the hustings on the 1st of May. Is there any? I'm going to be there in the audience anyway.
Well, you keep an eye on them. I'm not going to personally be there myself. No.
Yeah.
We have advised across the whole process.
Right. Thanks.
Thank you all, and thank you for your input as well. So have a good evening, everybody, and we'll see you on the 13th of May. Thank you.
Thanks very much.
Bye,
Good night.
everybody.
Thank you.